also like to share some information now, moving on, about the number of cases and the demand for care. Dr. Hines would have indicated that as of December, we would have noticed an increase in the confirmed seven-day rolling average of confirmed cases, and this inevitably leads to an increase in the demand for hospital beds. And this graph demonstrates, if we look at the bottom line here with the orange bars, demonstrates that there has been an increased demand for hospital care and hospital beds over the last month. And this really coincides with that increase in cases. Specifically, we have noted that increase from December the 8th, and it has been consistent on a daily basis. So for just over 1 month now, there has been an increased demand for care. I'd like to now draw your attention to the actual number of COVID-19 patients in the 9 hospitals in the parallel healthcare system and in the now hybrid system. And as of 8 a.m. this morning, there were 71 COVID-19 patients being treated in the public health system. 50 of those patients are in the parallel healthcare system, while 21 are in the hybrid system. Now, when we look at that 71, there are 5 of those patients that require ICU level care, and there are 2 pediatric cases within that 71. And I'd just like to draw a distinction here in how we have been classifying these cases on the basis of what we term primary and incidental COVID-19 cases. So we have found that some of the cases that present are what we would call primary cases. Primary cases are those persons who present with symptoms of COVID-19. So they would come into the accident and emergency via the ambulance with fever, shortness of breath, and a cough. Incidental COVID-19 cases are those persons who present for a non-COVID complaint. It could be a diabetic foot, it could be a car accident or congestive cardiac failure, or some complication of a comorbidity, but on arriving at the hospital and being tested, they are found to be COVID-19 positive and then require care in that area. So we have, as I said, 71 patients this morning. Just for a matter of context, in November of this year, the average number of patients, COVID-19 patients per day, was 20. So you can well appreciate that the numbers are increasing. But I would like to reassure the public that the capacity is there within the parallel healthcare system and now within the hybrid system, and that we are monitoring trends in terms of occupancy, in terms of the clinical nature and clinical status of these patients on a daily basis to ensure that the relevant reallocation of resources or expansion of services can occur.
The red is December of 2022, where those bars start to get a little higher. And then the first 2 weeks, because we're only 2 weeks into 2023, the green bars represent the weeks in January. Bearing in mind that we are on day 3, completed day 3 of the second week in January, and yet that bar is almost as high already as the first week. So we are seeing an upward trend in those numbers of cases from week to week. I'll show you the actual figures in the next slide. But we're also seeing an increase in what we call the positivity, percentage of patients tested and turning out to be positive for COVID-19. So you see both of those in this slide. This slide shows the epi weeks on the left. It shows the dates, both at the start and the end of the week, so you know which month we're in. So we're starting essentially at the end of October, start of November. And if we look at the numbers of cases on a weekly basis, we saw those rise from low hundreds, 118, 119, through to 150s. And as we got to end of December into January, we're now seeing 204, 338. So we are seeing increases in those weekly totals. If we look at the last 2 cells on the right-hand side, the ones that are in red, we notice that from week 50 to 51, or rather 51 to 52, that is from the week that ended on Christmas Eve to the week that ended on New Year's Eve, there was a 38% increase in the weekly total. And then the following week, that first week of January, that completed week was 65% higher than that. So we are seeing a pick-up, an uptick in the speed at which the weekly totals are increasing. So that's something that we're bearing in mind, and we know that it is, to some extent, driven by all of the gathering and mingling that we would have done, and we note that it will be driven further by the gathering and mingling that we plan to do. So we do need to, at this point, put out some cautionary advice in terms of bearing in mind the presence and the potential for spread for this virus that has not left the population.
We first detected Omicron in Trinidad and Tobago in December 2021, and it's been dominant since early 2022. To date, of all those subvariants that have been circulating around the world, we have detected 68 in Trinidad at different times and at different levels. And of those subvariants, there are some of them that are classified as Omicron subvariants under monitoring by the WHO. They get that classification because they show signals, and not confirmed, but they show signals of spreading more quickly, and they have mutations that are either known to or suspected to confer changes in their epidemiology and to give them some sort of fitness advantage over the other ones. So those are the ones that we monitor, the Omicron subvariants under monitoring. We have detected 6 of them, as we've heard, in Trinidad and Tobago. We have BA5.2, BA4.6, BF7, BA2.75, BQ1, and XBB1.5. I'll turn to XBB.1.5. That variant, it has now been reported in 38 countries to date. Over 80% of the sequences that have been derived from samples are from the United States. Okay, so it's mainly in the United States. We detected in Trinidad in 4 samples so far, and those are shown in dark blue, so they're quite recent, with the first detection was on December the 10th, a sample collected on December the 10th.